Listen, I know studying for the NCLEX can feel like you're trying to drink from a fire hose. There is just so much information to know. You're going to be tested on everything. And one area you definitely don't want to be caught off guard on is sexually transmitted diseases, or STDs. Why? Because as nurses you'll be on the front lines of patient care, providing education, treatment, and support to those affected by these infections. Trust me, knowing STDs inside and out is not only crucial for the NCLEX, but for your future patients as well. So, in this video we're going to break down everything you need to know about the most common STDs, from causes and symptoms to diagnosis, treatment, and key nursing considerations. Think of this video as your cheat sheet for acing your exams and becoming a top-notch healthcare professional. Let's get started. First up, let's talk about chlamydia. This bacterial infection is often called a silent infection because most people, especially women, don't experience any noticeable symptoms, at least not right away. That's why it's so important to understand the subtle signs. Now, chlamydia is caused by the bacterium Chlamydia trachomatis, and it's primarily spread through sexual contact. Symptoms when they do occur can include painful urination, discharge, and pelvic pain in women. Guys, on the other hand, might notice discharge from the penis, burning during urination, or even pain and swelling in the testicles. To diagnose chlamydia, we typically rely on urine tests or swabs of the affected area. The good news is it's easily treated with antibiotics like azithromycin or doxycycline. As nurses, your role will be to emphasize medication adherence because not completing the full course of antibiotics can lead to complications and increase the risk of reinfection. It's also crucial to educate patients on the importance of practicing safe sex to prevent the spread of chlamydia. Next, we're going to tackle another common bacterial infection, gonorrhea. Just like chlamydia, gonorrhea often doesn't cause any symptoms, especially in women. But when it does, it can present as painful urination, abnormal discharge, and pelvic pain. Now, gonorrhea is caused by the bacterium Neisseria gonorrhea and is primarily spread through sexual contact. For men, symptoms can include a burning sensation during urination, white, yellow, or green discharge from the penis, or pain and swelling in the testicles. Diagnosis again involves urine tests or swabs, and the treatment is typically a single dose of an antibiotic, usually ceftriaxone, given as an injection. However, due to rising antibiotic resistance, treatment recommendations are always evolving, so staying updated is crucial. One of the most important things to remember about gonorrhea, and this goes for chlamydia too, is that partner notification is essential. You'll need to counsel your patients to inform their partners so they can also be tested and treated, preventing further spread of the infection. Let's move on to syphilis, a bacterial infection that can have serious consequences if left untreated. Now, syphilis is caused by the bacterium Treponema pallidum. It's known as the great imitator because its symptoms can mimic many other diseases, making it tricky to diagnose. Syphilis typically progresses through several stages. The first stage often involves a painless sore, called a chancre, at the site of infection, usually the genitals, rectum, or mouth. If untreated, it can advance to the secondary stage, characterized by a rash, fever, fatigue, and swollen lymph nodes. Now, to diagnose syphilis, we use blood tests to detect antibodies to the bacteria. The good news is, if caught early, syphilis can be effectively treated with penicillin. However, more advanced cases might require multiple doses. As nurses, your role will be to monitor your patients for treatment response and emphasize the importance of follow-up testing to ensure the infection is completely cleared. Now, let's dive into HIV, or the human immunodeficiency virus. HIV attacks the immune system, specifically the CD4 cells, which help the body fight off infections. Over time, HIV can weaken the immune system to the point where it can't fight off infections and diseases, leading to AIDS, or acquired immunodeficiency syndrome. HIV is spread through contact with infected bodily fluids, such as blood, semen, vaginal fluids, or breast milk. It's important to understand that HIV can be transmitted through unprotected sexual contact, sharing needles, or from mother to child during pregnancy, childbirth, or breastfeeding. Now, early symptoms of HIV can resemble the flu, with fever, fatigue, sore throat, and swollen lymph nodes. However, HIV can also be asymptomatic for years. Diagnosis is confirmed through a blood test, specifically an HIV antibody test. While there's no cure for HIV, thankfully, with proper treatment, people with HIV can live long and healthy lives. Antiretroviral therapy, or ART, is used to manage the virus, and it's incredibly effective at suppressing viral replication, preventing the progression to AIDS, and reducing the risk of transmission. Let's move on to another viral infection. Herpes simplex virus, or HSV. HSV is actually quite common, and there are two main types, HSV-1, which typically causes oral herpes, also known as cold sores, and HSV-2, which usually causes genital herpes. HSV is spread through direct contact with an infected person, usually through oral-to-oral contact for HSV-1 and sexual contact for HSV-2. Now, one of the tricky things about HSV is that many people don't experience symptoms, or their symptoms are so mild they don't even realize they have it. When symptoms do occur, they often involve painful blisters or sores around the mouth, genitals, or rectum. Diagnosing HSV typically involves a physical exam, taking a swab of the sores if present, or a blood test to detect HSV antibodies. While there's no cure for HSV, antiviral medications such as acyclovir or valacyclovir can help manage outbreaks, reduce their severity and duration, and lower the risk of transmission. Finally, let's talk about human papillomavirus, or HPV. This is actually a group of over 100 different viruses, some of which are sexually transmitted. Now, most HPV infections clear up on their own without causing any problems. However, certain types of HPV can lead to genital warts, or increase the risk of certain cancers, including cervical, anal, and throat cancer. Symptoms of HPV can vary depending on the type of HPV. Some types may cause genital warts, which appear as small, flesh-colored bumps in the genital area. Other types may not cause any visible symptoms at all. That's why regular screenings are so important. Diagnosing HPV often involves a PA test for women, which screens for cervical cell changes that could indicate HPV infection or early signs of cervical cancer. While there's no cure for HPV, there are highly effective vaccines that can protect against the types of HPV most likely to cause cancer and genital warts. So there you have it, future nurses, your crash course on the most common STDs. Remember, knowledge is power, and by understanding these infections, you're not only setting yourself up for success on the NCLEX, but you're also equipping yourselves to make a real difference in the lives of your patients. Don't forget, early detection and treatment are key when it comes to managing STDs. Encourage open and honest conversations with your patients. Promote safe sex practices and regular screenings, and always stay updated on the latest treatment guidelines and recommendations. You've got this, future nurses. Keep up the amazing work, and I'll see you in the next video.